So you consider prediabetes sort of like a very early, or it could, as something that could become diabetes, correct?
Yeah, it's kind of like a warning,
Okay.
you know, like, hey, you know, your blood sugars are getting higher. They're not quite in the region of diabetes yet, but you're headed that way. So now's a great time to make diet changes. Now's a great time to make exercise changes.
Okay.
Whatever changes you can make. A lot of times, you know, we were saying people don't realize, hey, my sugars are high, you know, and then suddenly it's like a little bit of a change in diet and lifestyle.
Now, how serious can prediabetes be?
So prediabetes is something that we consider as, you know, potentially serious because of other risk factors. So, you know, we look at the whole patient and we think about whether the patient is obese, does the patient have heart disease, does the patient have cholesterol, does the patient have blood pressure. So, you know, it is again in a cardiovascular risk stratification. So it's very important that if we can avoid the development or onset of diabetes, if it's preventable by diet and exercise, we want to encourage that.
Right. Now, we talked earlier about the alarming numbers of the sugar intake nowadays. So with that being said, how common is for prediabetes now?
So, you know, it is becoming more common because we're also detecting it more. And so as more people go for screening, we're going to start seeing it more often. And also because of our diet and lifestyle.
Okay.
You know, nowadays we're all not as active as we should be. And certainly we have a diet that is, you know, full of processed foods and excess sugars, as we were looking at the pie chart earlier. So it's something that we're seeing on the rise.